Good afternoon, ladies and gentlemen. You welcome to your health program, You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Esie Lucy Liengu. It is a complex disease that poses significant health challenges, not just to individuals but families and also healthcare systems. It can cause a strike suddenly, leading to a devastating and physical cognitive impairment, and often leave survivors facing a long and difficult recovery journey. Ladies and gentlemen, sure you must have guessed our topic for today. Today, in this edition of your program, we'll be looking at the topic stroke, how it is caused, the prevention, and why not treatment options which are available to help curb the disease. And with me here in the studio is a cardiologist. But before I introduce our guest, I have the honor to introduce my co-host for the day. Good afternoon, Immaculate Foglu.
Good afternoon to you, Lucy. Good afternoon to our guest of the day, and good afternoon to our millions of televiewers and also listeners. It's always a pleasure being with you all.
Always a pleasure, Immaculate. And our guest for today is no other person than Dr. Cabral TANTCHOU. He is a cardiologist. Good afternoon, doctor. It's a pleasure.
Good afternoon, Lucy. Good afternoon, Immaculate.
You're always welcome to the program.
Thank you very much.
And without any waste of time, we'll go directly to our first question. We'd like to know, to a layman's understanding, what is stroke all about?
It's very, very important to understand, as you are saying, the anatomic view of the problem. Now, the brain is having some vessels that are bringing oxygen and that are bringing nutrients to the brain. And vessels are what? Are pipes, some small pipes. There are some small pipes that are going to the brain. We talk about stroke when the supply of blood in the brain is altered, or the supply is low, or there's no supply at all due to what? It can be an obstruction at the level of the vessels. A clot, also, or the vessel can burst. And when it bursts, blood goes out of the vessels and off of the vessels, yes, and a part of the brain is not receiving any more blood, and and physically and clinically is what we call stroke.
And now, what are some of the causes, or before we go to the causes, we'd like to know the difference between the various strokes that exist. We have ischemic stroke and a hemorrhagic stroke, if I'm not mistaken. So what are the different types of stroke that exist, and how do we differentiate them?
As you said, there are two types of stroke, hemorrhagic stroke and ischemic stroke. Hemorrhagic stroke is what? Is when, as I said, from the pipe bursts and blood comes out and in the cranial cavity and gathers there, and a particular part of the of the brain doesn't receive blood. The second one is ischemic. It's when the vessel is blocked due to what? It can be atherosclerosis, it can be cholesterol, it can be a problem. You know, there are some cardiopathies that are calling embolic cardiomyopathies, when the heart doesn't beat well, when there's atrial fibrillation, or when the heart is too dilated that it doesn't pump blood well. There's a probability of formation of clots, and those clots, you know, there's a big vessel that brings blood to the whole system, the aorta, and through those vessels at the level of the aorta, they go to the brain and bring damage. That's why it's very, very important. Again, very, very important. If you are feeling somehow, your heart is not beating well, you are having headache, you should come and consult. Let us be sure that everything is not too bad, because sometimes you can really be, those symptoms sometimes are symptoms that are indicating that you can have stroke.
Okay.
And some people, they will neglect, thinking that, you know, everything will be okay. Meanwhile, there's a big problem.
Okay.
Now, what's the prevalence rate of stroke in Cameroon, and what accounts for the increase in cases of stroke?
The prevalence of stroke in Cameroon can be from 15% of cardiac patients, and increase, yes, because of our lifestyle changes. People are more smoking, people are eating more things that are big, that are coming from that other side. poorly processed food, everything that is canned in those packet. Anyway, much alcohol. People are smoking. People are eating much food that is having cholesterol. There's less physical activity. These are things really that are making that disease to increase.
Why is it that people who are hypertensive or diabetic have higher chances of developing stroke?
Definitely, hypertension is especially hypertensive that are not controlled, hypertensive that are not taking their medication. When you're hypertensive, we are talking of, there are also risk factors of all those things. When you're hypertensive, the blood pressure, if a high pressure passes in your vessels, and your vessels, instead of being flexible, it becomes hard. And the majority of those people used to develop hemorrhagic stroke. Why? Because when the vessel is hard and you are not taking your medication, at a particular level, they have a peak of hypertension, the vessel will burst. And really, it's not a good condition. And diabetes too. Diabetes, there's a terminology or a term in science called endothelial dysfunction. In people that are having diabetes, there's really endothelial dysfunction, and that is what is bringing changes also in the vessels, not only the hardening of the vessels, also the intima of the vessels gets altered, and in that particular group of people, they can develop stroke easier and faster than someone that doesn't have it.
The numbers for those who like to join us.
For those who like to participate on today's edition of the program, here are the contacts: 670 54 70 49. I repeat, 670 54 70 49 or 656 62 22 22. 656 62 22 22. Those are the numbers you can call to participate on today's edition of the program.
And now back to you, Doctor. I'd like to know, what are some of those warning signs that we should watch out for when it concerns stroke?
Very, very important. As far as stroke is concerned, the warning signs: headache. Headache. It can be frontal headache. It can be pains in the backside, at the neck too. Yes, it can be blurred vision. It can be paresia of one arm. They will come and say, this arm, is not responding as it was responding before. They call that kind of condition paresia of, or it can be the left arm, it can be the right arm, or the left leg, the right leg. It can be palpitation, the heart that will be beating so fast, too fast, that, and you'll be feeling it.
We're coming back to you. I have a call on the line. Hello.
Hello.
Good afternoon, sir.
Afternoon.
Your name, where you're calling from, and your question, please.
I'm Tamalikwa Bernard.
Okay.
Calling from Yaoundé. So,
okay. Happy to have you. Go ahead with your question.
Yeah, I want to take part in the program that is going on about the stroke.
Go ahead.
Yeah, I wanted to ask the doctor, for example, I think my mother died of stroke because she had stroke there in Bamenda, and then nobody was beside her. Apart from before they came beside her, she was already stroking, something like that. But after she was taken to the hospital and she lost her voice, she made about 6 months after that she was not talking. I took her to many hospitals, many therapies, everything that we did, that her voice never came back. And maybe because of that voice, that when she developed high, and that's what caused her to lose her life. I just want to know, how can we do to prevent? What immediate treatment, what immediate prevention one can take when you are beside somebody suffering from, and what are the symptoms that makes you to know that it is a stroke that is affecting this person?
You already outlined the warning signs, but I think you didn't get it, so we can help for you.
All right, thank you.
Thank you so much.
Yeah.
No problem. I will try to respond again. Lucy asked that question. Yes. The warning signs. It's very, very important first for people that are having hypertension to be taking their medication. That one is very, very important. And those who don't take medication is when definitely there will be a peak of hypertension and they can be prone to develop stroke. The warning signs, I said it, paresthesia, you know, you will not feel as you were feeling before. Your arms, it can be the left, it can be the right, it can be the left leg, it can be the right leg. Numbness, dizziness, slurred speech, or your vision can be blurred by the particular time, and it can be headache, it can be frontal headache, it can be back, the back of your head, that can be really be very, very painful.
Like
it
nerves.
Yeah.
Like nerves.
People that used to say nerves. What is nerves actually?
Nothing.
Nothing. Because always when you start feeling your neck, automatically you know that it's nerves.
Yeah. Definitely, but really, if you are reading the books, you know, medical books, you don't see any place where you say nerves. Yes, and there are so many people that are coming having nerves.
I'm nervous. Yes, of course. Lucy, I slept bad. I think I'm nervous. Yeah.
Definitely. When you're having those pains, please come and consult.
Okay.
Yes, and the majority of those people is when the blood pressure is too high, and not taking their medication, and some they know when they are coming say, yes, I knew that would be like this because for long I didn't take it. And not only that, sometimes also one side of your face really can be deformed. Yeah. If you see those symptoms, I beg you should rush to the hospital. Let us really take care of yourself.
Okay, then we also like to find out what are the immediate actions to take before you take someone to the hospital. Like someone in the local language, we already say don't fall stroke. So when someone is being affected by stroke, like the first time, what are the immediate actions you can take first before taking this person to the hospital?
As far as stroke is concerned, you should take direct to the hospital. There's nothing particularly that you can do. Yes, if the person, I don't know, has vomited, probably you should clean his mouth. If the person he felt somewhere, you should get him up. But there's nothing precise like when there's cardiac arrest. When there's cardiac arrest, there's something that you can do. When there's myocardial or heart attack, there's something that you can do. But those, as far as stroke is concerned, you go direct. It's an emergency. You go direct to the hospital.
Doc, while talking about the case of hypertensive patients and diabetes, you made mention of the fact that regular checkup is very necessary. But we have cases of... We have another call on the line. Hello?
Yeah, hello.
Hello, madam.
Yeah, good afternoon.
Good afternoon, madam. Your name, your question, where you're calling from, and your question, please.
I'm Linda. I'm calling from Adamawa, from Bani.
Okay.
Please, I wish to ask the doctor that if somebody is already paralyzed, having stroke, is there a possibility that the person can come back and be normal again after treatment?
Okay.
Thank you so for your
much.
question.
Thank you for your question.
That is a very good. It's a very good question. First, we are talking about hypertension. We are talking about diabetes. It's very, very important, people. When you are taking a medication for hypertension, you should come for review. You should come for follow-up. Don't go with your medication for hypertension, taking it every day, thinking that you are fine. No, you can be taking and your blood pressure doesn't go down. You can be taking and your blood pressure goes too low, and it's not correct. Yes, the first thing when you're having stroke, as soon as possible, you go to the hospital, and there's physiotherapy. There are other medications really that will be given, that will be prescribed, and also the family members. Their role is very, very important in this type of condition, because there are so many people that will be depressed. We have another
call on the line. That will be coming back to that. Hello.
Yes, hello.
Good afternoon, sir. Your name, where you're calling from, and your question, please.
Okay. This is Barry. I'm from Limbe.
Okay.
Your question,
Go
sir.
ahead.
My question is, what are the root for diabetes?
Didn't get you, please. Can you repeat yourself?
Yes. What are the root causes for diabetes?
What are the root causes of diabetes? Is that it?
Yes. What are the causes of diabetes?
Okay.
Yes, that's it.
Okay.
Thank you.
We'll first finish the first question, then we'll go to this.
Yes. I was talking about the follow-up of patients that
Exactly.
are having hypertension or diabetes. It's very, very important. And when you're having stroke, as soon as possible, you should come to the hospital because they will prescribe, a therapy that will help you to recover. And also physiotherapy at this level is very, very important. For the patient, we need to be able, and again, it depends on so many factors. If the patient is young, the probability for the person to get use of his extremities as he was before is high. When you are old, can you imagine somebody that is 70 years old is developing stroke and someone that is 40? You see, 70, your parameters and your brain, your cells are already old, and really to recover and again, depending on the level where the lesion is in the brain. If it's a big artery that responds for many centers of your brain, really, to say that you will recover, I cannot really, the prognosis there, let me say, truly is poor. If you are 40, your cells are not too old. Your cells can, they're having that probability of regeneration. Your cells can get better. And if everything is together, because there are so many money. You start with therapy, yes.
Money.
Yes. You start with therapy. You see
Yeah.
that everything is going on well.
Yes.
The patient is responding well. The patient wants to get better. And at a particular moment, there's no money. You see, and everything goes again back. But when everything is gathered together, there's money, there's medication, physiotherapy, and if the patient is not too old, yes, let me mention that. Yes, it will be better. Yes, you see how many people they recover. They recover. Of course, they will not be as it was before, but you see how the patient can do everything that he was doing before. And again, our goal when a patient is having stroke, it's not that he should be as he was. If he can really help himself, what we have in mind is the person to help himself. If he can eat alone, if he can go to the toilet alone, if he can just stroll around alone,
It's already something.
Yes.
So
No. The goal has been
Exactly.
achieved. We are not expecting him to run, or we are not expecting. No, as soon as that goal is achieved, perfect.
So
Hello, but that's not my question. I asked you that what are the risks of diabetes?
okay,
Yes.
We are coming to your question now.
Correct.
question now.
Gentlemen, wait, be patient now.
we had other questions. Okay.
Yes, there are two types of diabetes first. There are two types, the type 1 and the type 2. And the majority of people of having type 2 diabetes is when there are some cells that in the pancreas that are not, let us say, they are not recognizing insulin that the body is manufacturing or the body is making. And the level of sugar in blood is getting high. Yes, that's it. That's it. And usually it's in obese people that are really fat.
Obese.
Yes,
Okay.
yes.
Our technician is already telling us time is almost up. Any last word? How can we prevent the stroke?
Take your medication for hypertension. Come for controls, and really, I'm sure that you will not have stroke.
What about lifestyle changes? What are some lifestyle changes to make?
Definitely. You have been singing all these things all the time here. It's very, very important. You should stop alcohol. You should stop tobacco. You should eat more fruit and vegetable. You should exercise physically. Sports. You have too fat obesity. You should really drop your weight. I think that's all.
Okay.
All right. Thank you very much, Doctor, for honoring our invitation today. Always a pleasure.
Thank you, Lucy. Thank you,
thank you
Immaculate.
to Immaculate.
Thank you so much, Lucy. Thank you, Doctor, too. And thank you to our millions of televiewers and listeners.
Sure. And ladies and gentlemen, we have come to the end of your health program, You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I have been here, Lucy Liengu, and was technically assisted by Louis Pego and Jonathan Babiola. And sure, we'll meet again next week, Thursday, same time, same hour. Do have a lovely day.
Ciao.